Did you know that the saliva ejector that you use every day may pose a potential risk of cross-contamination for your patient? In fact, the CDC cautions that backflow may occur with standard saliva ejectors when the tip becomes occluded. Studies show that a backflow of fluids may occur over 20% of the time. This means that if you treat 10 patients in any given day, at least 2 of them are at risk of contamination from backflow. During a typical procedure, it may be common for a patient to close their lips tightly around the tip of the saliva ejector, or for the saliva ejector to become blocked when placed under the tongue or close to the cheek. This blockage creates a temporary drop in vacuum pressure, which can cause backflow from the evacuation line into the patient's mouth, potentially exposing your patients to saliva, blood, and other potentially infectious material from previous patients. What if your patients knew that this could happen during their dental visit?
As clinicians, we know that patient safety is a top priority, and with growing numbers of both immunocompetent and immunocompromised patients seeking dental treatment, this potential risk must be taken even more seriously. Stop backflow in its tracks. Latex-free SafeFlow saliva ejector and HVE products provide a built-in one-way valve that eliminates the risk associated with backflow to your patients. SafeFlow does not affect the suction or performance of the tip, and there is no need to change how you work in order to protect your patients. Available as a complete saliva ejector valve system or as an adapter for use with standard saliva ejectors and HVE tips, SafeFlow is an effective single-use disposable that prevents backflow. When the on-off low-volume vacuum valve is opened, the vacuum system draws air through the check valve in the tip. As this happens, the check valve opens in the direction of air and fluid flow and remains this way during operation. Once the suction is stopped or blocked, the check valve immediately closes to create a physical barrier that stops air and fluid from backflowing. The SafeFlow HV valve and the adapter are used with the high-volume evacuation line and allow you to use the HVE line with your choice of tips. Eliminate hassle for you and your patients. There's no need to change handling or even evacuation hose positioning, and the effectiveness of SafeFlow is not dependent on patient compliance.
Stop backflow in its tracks with SafeFlow saliva ejector products.